Is it safe to give cortisone shots frequently after a joint replacement?
So the question was, how safe is it to have injections? In this question, it was asked about cortisone injections on an already replaced hip or knee. This is something that I don't know if we have raw data to really answer the question scientifically, but I am a physician that doesn't recommend frequent injections in a replaced joint. The concern would be that once you have a prosthesis in the joint, there is a higher risk of inducing an infection into that joint, even with something simple like placement of a needle into the joint. The skin has bacteria that lives on it, and that's normal. Even when we use skin cleansers and prep the skin before placing the needle, probably the number of bacteria is not completely reduced to zero. So there's always that risk. Although it is rare, I have seen cases before where that's happened, and patients have had an induced infection. So I typically do not recommend that that be done unless it's for the purposes of the injection being used in a diagnostic purpose. So if for some reason the physician wants to use the injection to help diagnose a problem, I think then there's a good reason to do it. Or if, for instance, you need to obtain some fluid from the joint in order to analyze it, again for diagnostic purposes. But I don't generally recommend that it be done for pain relief.